We're behind schedule. I think
I wish you all a prosperous new year.
I decided from January till now, doctor is here to tell you whether he's right or wrong. Okay, some of you who love to chew too much of pomo this season, or too much of beef, or too much of chicken, or too much of what again? Drink, alcohol, too much of sweetie, like a friend called. The friend say, send me money, may I buy sweetie? And I asked, what sweetie? Say anything with the sweet. Like I don't want to mention the brands. Make I not go give them cheap adverts. You know, nine be sweetie. Some of you have consumed. You've been consuming sweetie since, huh? Yeah. Shortly, doctor will be talking to us as regards our health, your health, my health. Okay. But then Prince is here. Prince Chilaka is also here. We just want to discuss something briefly. You know, happened this year, and for some persons, well, this year. Well, thank God we are alive. But then, as the year winds down, I want to capture. I've been able to capture some of the most dominant events that shaped political discourse and challenged the effectiveness of government policies for the masses. The first one. You remember this year, the Badner explosion. You remember this year, the Badner explosion. You remember, right?
Yeah.
Yeah. The Ibadan explosion, the series of explosions in Ibadan, the Oyo State capital, shattered the early excitement of 2024, raising concerns about the escalating menace of illegal mining across the country. The blasts, which dominated public discourse for several weeks, claimed 2 lives, injured several others, and caused widespread destruction of property. The explosion tore off rooftops and shattered windows, leaving many homeless for days, and of course, prompting costly government rescue operations. I just want to.
Over cups of rice.
I was still going to mention that.
Yeah. So it's very painful. It was a sad moment for a lot of us, for a lot of Nigerians who have experienced the good side of Nigeria. Watching people die because they're hungry, because they are starving and all of that. So that itself should be something the government should really be thinking about. How do we get out of this situation? Because, like I said to somebody, I've said to several people, we may end up having more stampedes in 2025. What we're seeing in 2025.
Really?
Yes. Don't forget that because of the actions of the bandits, the terrorists in the far north, farmers have not been going to the farms. So we're not even talking of food now, because there's no harvest. No harvest has taken place. So where are we going to get food in 2025?
Serious.
And then the government said, oh, we're giving windows for people to import food items at no cost. But it wasn't implemented. So in 2025, where are we going to get food? How are Nigerians going to survive? So what we just seen play out in the last, the tail end of 2024 in terms of stampede and all of that, it may get worse in 2025.
All right. Aside that, there is this Binance executive detention. That guy who was
Crypto guy.
Yeah, the crypto guy.
Well, my position on that is, I think, relating that to the CIA report.
How everything played out thereafter.
Good.
Now,
well, I said relating it to the CIA report that Mr. President is an active asset to them.
Yeah.
I think that also played a role in letting the guy loose. Yes, because the whole thing happened so quick, and charges were more or less dropped, and unfortunately, Nigeria is a country where we've lost touch with investigative journalism.
Of course.
Yes, we've lost touch with it. So you don't get to find out. You just get to hear the news, flashed, but you don't get to find out the end of it, and it's not good for us as a people. So it's like we don't have a history anymore. So we shouldn't now. You're raising it. What has happened to it? The guy has been acquitted or what? Or is it that there was no case in the first place?
Probably there was no case in the
As we're talking about, we should also be talking about the former CBN governor, Mefele. How far with his case? And we move from there to Beta Edu. How far with his case? So we just have, pocket of cases here and there that has not been resolved and has not been sorted out. It's unfortunate, but what do we do?
And then aside that, the what's it called now? The Kano Emirate tussle. The Kano Emirate tussle is another one. The Kano Emirate tussle is another one. It happened. For me,
I think
first half of the year.
The whole thing got out of hand because of the involvement of the government.
Okay.
It's purely something the government should not be involved in. Yeah, so when you now have a federal mind trying to truncate the state mind, you have chaos, you have, situations that cannot be, taken care of. But that's what it is. That's Nigeria for you.
And what's up with the cabinet reshuffle?
Was that a cabinet? Was it really a cabinet reshuffle? You sack 5, you employ 7. I don't get it. There are some ministers we had hoped would be, asked to go and rest, like the Minister for Power. But then he was there, and then, what's his name? Bayo Nanoga came up with one upsetting, nauseating story that Nigerians voted for who will be a minister, who will remain in the cabinet. And I was asking, when was this voting carried out that I didn't get to vote? So there's so much lie in the system.
Okay. All right, everyone, let's go on a very short break. Okay. And when I come back, we'll talk more. Stay there. My name is Judeh.
We dey work for dough. Some days it's fast, some days it's slow. Many highs and lows, but we carry go. Nothing go stop our doing so. Now the night just spirit, yes we move. With family, there's love at home. We know say Christmas, it don't come home. Parampe.
Hello, I go. Everywhere you go. Everybody go lo. We go enjoy,
So we go celebrate. Say yellow Christmas, so we celebrate. When you hear the bedroom, everybody celebrate. We say yellow Christmas, so we celebrate. We do it anyway, any place.
Disconnect from distractions. Go make a difference this season. Merry Christmas from MTN.
Season's greetings from Polaris Bank, the digital bank of the year. On behalf of the board, management, and staff of Polaris Bank Limited, we thank you all, our customers and partners, for your patronage and support. We look forward to serving you better in the new year. Download Vault from Google Play Store or iOS App Store today for your convenient and secure banking.
Yes, they go, we dey work for dough. Some days it's fast, some days it's slow. Many highs and lows, but we carry go. Nothing go stop our doing so. Now the night just spirit, yes we move. With family, there's love at home. We know say Christmas, it don't come home. Blow the trumpet, parampe.
go. Everywhere you go. Everybody go lo. We go enjoy,
So we go celebrate. Say yellow Christmas, so we celebrate. When you hear the bedroom, everybody celebrate. We say yellow Christmas, so we celebrate. We do it anyway, any place.
Disconnect from distractions. Go make a difference this season. Merry Christmas from MTN.
All right, welcome back, everyone. It's Voice of the People, 90.3 FM. I just want to touch on just one or two other issues with Prince Chilaka, and then we're done, and then we start talking health quickly. All right. The other one I want to mention is the tax reform controversy that is still on ground up until now. You know, since Tinubu introduced these tax reform bills to the National Assembly in October, the proposals have been a major point of contention. These whole bills. What do you think?
I'll say this about the tax bill. In as much as the government has given 1,001 reasons why they want to implement it and why it should be implemented, I think that this government keeps putting the cart before the horse. Mr. President did it with the fuel subsidy removal. There are more pressing issues than tax in Nigeria today. And one of the most pressing issues in Nigeria today is insecurity. You know, from the north to the south to the west to the east, people are being killed daily, people are being kidnapped. So I think government should have focused more on curbing insecurity in the land and then gradually talk about tax reform. See, the story behind it is that, it's going to be good for ordinary Nigerians who earn below or within the new minimum wage. But the question I also have to ask this government, all the previous taxes that has been collected before, who is giving account of it? And who will give account of this new tax regime we're talking about? And why is it that the tax regime seems to be dividing Nigeria into two? Because it's now more like the north against the south. So something is wrong. It's either the people responsible for educating Nigerians in terms of the benefits, the real benefits of this tax reform have not done their job very well, or it could be that the governors in the north or the northern leaders are trying to be funny and play a prank. So we need to know, because the way the north have come out against it shows that there is more. There is more to it that the ordinary eyes cannot see. So I would rather prefer a situation where the National Assembly takes its time and do justice to it, so that at the end of the day, nobody will feel cheated or anything.
All right. There was just one more thing, just the last one, I want to mention before I let you go is what's it called? The national grid collapse and
government. The people to trust the government when you give the right information. Unfortunately, there is a trust deficit between the government and the people. So whatever the government says, the people will always say, "I beg." It's like talking about the refineries. Nigerians are still, don't still believe that Port Harcourt refinery is working. And then you now added the next one, which is the Warri refinery. So people are just saying, it's just propaganda. But like I say, it's the duty of government to hide things. It's the duty of the press to fish them out. But unfortunately, Nigerian press have become so docile in so many areas. And it's really, really affecting accountability. It's affecting the relationship between the government and the people. But I think the government can do better. They have the machinery. Let information flow. Let the people know the truth. And let the people deal with it the way they seem, fit.
Okay.
So then talking about the national grid. What can we really say? Surrounded by light but living in darkness.
It's a shame. It's a pity.
Yes, it is. Because, like I keep saying, you created bands, different bands, band A, band B, band C, but you did not take care of the real issue. The real issue is how much are you generating? What you're generating, will it be able to go in around to the people? Those are things government should have done. They should have set in first the infrastructure to ensure that when we do this, these people will have light. Nigerians will pay. I know that for sure. But nobody wants to pay for darkness. And then, if you recall also, when Labour was trying to negotiate with government over the national minimum wage, I think they went on strike and they shut down the
Of course.
the grid. And your Senate president came out and said that it was treason, that they were going to charge them for treason and all of that. And then, before you know it, DSS started hunting NLC president. But then, when these things happen, who has been called to order? Who has been arrested? Who has been charged for treason? This year already, I think there were 11 or so.
That's a big question.
Yes. So if you're going to charge Labour for treason because you believe they shut down the national grid, when the national grid collapses on its own, who do you hold responsible? Who do you take to court? So you can't have two laws operating in a country, one for those in government and one for the ordinary Nigerians.
Okay.
But that's the unfortunate situation.
Thank you so much, Prince Chilaka. It's nice doing business with you this morning. And of course, it's the last day of the year.
Yeah, I mean, we tried to do this severally, but
of course.
Yeah.
Of course.
So today is the day.
Well, thank you so much.
You're
Thank
welcome,
you.
Judy.
Everyone, Dr. Charles Adiogun is to take center stage now. I will be right back shortly. Stay there, don't go nowhere.
Season's greetings from Polaris Bank, the digital bank of the year. On behalf of the board, management, and staff of Polaris Bank Limited, we thank you all, our customers and partners, for your patronage and support. We look forward to serving you better in the new year. Download Vault from Google Play Store or iOS App Store today for your convenient and secure banking.
They go, we dey work for dough. Some days it fast, some days it slow. Many highs and lows, but we carry go. Nothing go stop our doing so. Now the night just spirit, yes we move. With family, there's love at home. We know say Christmas, it don't come over. Blow the trumpet, it parampe.
Hello, I go. Everywhere you go. Everybody go low. We go enjoy, we go
Celebrate. Say yellow Christmas, so we celebrate. When you hear the bell, do everybody celebrate. We say yellow Christmas, so we celebrate. We do it anyway, any place.
Disconnect from distractions. Go make a difference this season. Merry Christmas from MTN.
Season's greetings from Polaris Bank, the digital bank of the year. On behalf of the Polaris Bank Limited, we thank you all, our customers and partners, for your patronage and support. We look forward to serving you better in the new year. Download Vault from Google Play Store or iOS App Store today for your convenient and secure banking.
Voice of the People, 90.3 FM. Everyone, welcome. Now, it is the last day of the year, and there are a lot of things you watch out for. Not, political stories alone, but there are some things that concerns you, your body. If you're not alive, you won't listen to the president's speech. You will not listen to your governor or whoever in the country that is annoying you. So let's talk about your health. I decided to bring doctor today because it is the last day, and this season, a whole lot of persons are consuming some, I don't know what I should call it, unnecessary liquor. Just consume a whole lot that is not good, actually good for your body. And then there are some other things I would also want to mention that I see almost everywhere, these days. I was talking to the doctor about, is it the lungs, right? Or liver? Exactly. And so we want to talk about these things. I see several persons having this one swollen part of the body, leg or something, And some persons will tell you fever that has refused to go for like how many weeks now or how many months. You keep feeling the same thing, Then cataract is one thing. A couple of persons going blind and still, they still don't know what to do about it. And then what we eat on daily basis. These days now, they'll tell you there's no food. Anywhere you see food, catch them, eat them, anything is good to go. Drink anything to stay alive. Now, Agbo women are selling very well because that's the only way that's the only kind of drug or something you can take to mitigate against all of this. And so they are selling very well. But then Nigerians still don't know that all of these things have side effects, And that's why Dr. Charles Adeogun is with us this morning. We'll be looking at these issues until 12 p.m. My name is Judeh. Welcome. Dr. Charles, it's time to hear you. It's time to hear you. First of all, I want you to just say hello to everyone. And of course, it's a very beautiful season. Say hello to everyone first.
Good morning, everyone. Compliments of the season again. We thank God for sparing our lives to see the last day of the year. It's a great privilege. A lot of people began this year hoping they were going to be alive today, but, life happens. But we're grateful to God that we're here. And I wish you all a very blissful holiday and an amazing 2025.
Thank you. Now, aside the things I mentioned, as a doctor, I want you to tell us some of these things or some of those illnesses you've diagnosed, major ones, reoccurring ones, the one you hear almost every day. This one is having, this one is having, this one is having. This one. Maybe just give us 2 or 3 or thereabout.
Okay, thank you for that question. Being in clinical practice, you see a lot of patients across various age groups. And then you also notice that a lot of them present with some conditions more than other conditions. So basically, there are some prevalent ones that are on the rise. And they're the ones that we should bring to the limelight.
Of course.
And they include the high blood pressure, like commonly called hypertension, diabetes, and then cancers. So these are on the rise. And we have some other organ failures too that are on the rise. You have people with chronic kidney disease. You just hear suddenly that somebody you've known ever since, the person's kidneys are packed up, and everybody wonders how did it happen? But the good thing is that these things are preventable, because if you pick them up early, the outcomes are usually better. And for a lot of people, the reason why they present late to the hospital started with them feeling well. It didn't get there to that advanced stage overnight. It gets progressively worse with time when no intervention is put in place. So basically, hypertension, diabetes, kidney problems, heart conditions, and for men, prostate issues, it's almost like it's everywhere. It's almost like an epidemic. So we're asking people, please, don't wait till the last moment. Don't wait till when you get to the hospital and hear the doctor tell you, if only you were here 6 months ago, if only you presented 3 months ago, things would have been different. Would have been able to do something, because that's the last thing anybody wants to hear, that the doctor can't help you because the case is already advanced or cancer has spread beyond what they can curtail. So basically, hypertension, as we all know, a lot of people, because they don't have symptoms, they don't do anything about it. They don't even go to check it. So you're not going to wait till you have a headache or body pain. It is symptomless. You are going to feel like you are fine. You're going you're going to be doing your normal routines. You're going to be going out. You're going to be doing your trips, and something terrible is happening underneath. There's something sinister brewing that you have no idea of. And the thing is doing something terrible to your heart, to your kidneys, to your eyes, can predispose you to a stroke, predispose to a sudden death. And unfortunately, some people, it is when they have a stroke that it will be the first time ever they would know that they had elevated blood pressure, which should not be, because if they were aware, certain measures would have been put in place, medications, lifestyle changes, stress management, proper counseling regarding their diets, weight management, and all the necessary things that should be put in place would have been done. But unfortunately, many people, they present first as stroke patients, or some people are not so fortunate, sudden death. We hear of people suddenly slumping and dying. Nobody just slumps and dies for no reason. There's an underlying issue that was not addressed that caused that. So it's essential that everybody realizes that this thing is real. Your health is paramount, because there's no aspiration, there are no ambitions or whatever you want to pursue in life. If you do not have sound health of mind and body, it's almost impossible for you to to get across whatever your intentions are. So it's very necessary that we take responsibility of our health and we do the needful. And you budget for your health as you budget for every other thing. I keep hammering on that anytime I have the opportunity to do so. People budget for education, budget for housing, budget for transport, budget for food, but they forget health because they just assume they are fine. You just assume everything is okay. But the truth is, you're getting older every day. Things change in your body every day. You come from a family, there's a prevalent illness in that family that people in that family are predisposed to. You need to take, cognizance of those trends. You need to know that those trends, they carry a genetic basis. So because you belong to that family line, you must watch out for those things too. If you have a grandfather or a father or a mother with high blood pressure or diabetes, know that you are next in line if you don't do something. Because you being in that family is already a risk factor for you. So you are not the candidate for being obese. You are not the candidate for living a sedentary life. You are not the candidate for chronic alcoholism. You are not the candidate for not exercising. So there are some things that you do or things that you eat that raises your risk and increases your risk further more than you just being in that family. And the fact that you have a family history of a particular disease doesn't necessarily mean 100% of the time you're going to come down with that illness. Because if you take drastic steps, proactive steps, with proper guidance, you will be able to escape those illnesses. So these are the few illnesses that I think are prevalent that we see that a lot of people should know about and watch out for.
You mentioned prostrate. That is on the rise. Some persons just hear prostrate, but they don't know what it's all about. They don't know how, to tackle prostrate, the best way to tackle it, and all of that. Some people don't even know what prostrate is, if you ask me. So I would love you to break it down for us so we understand.
Okay, so the prostrate gland is a gland that is located just beneath the bladder, around the neck of the bladder. So around the bladder outlet is where it is located. So it's normally the size of a walnut, but over time, as a man ages, to start, it is only men that have prostates.
Only men?
Yes.
Okay.
So basically, it's a gland that is the size of a walnut normally, and it enlarges with age. So once a man gets to a certain age, we ask them to start running investigations that are related to the prostate. And when they have certain symptoms, those are obstructive symptoms that do not allow urine to be emptied from the bladder properly. So because it's around the outlet of the bladder, if it enlarges, it causes some obstructive symptoms. So those obstructive symptoms can present as a man waking up frequently at night to go and pee. Frequently, we mean 4 times, 5 times, 6 times before dawn. And then they may also have frequency of urination during the day. They go to pee now. They come back the next minute. They're excusing themselves to go and use the bathroom.
I thought it's diabetes that would make
diabetes can also diabetes can also give you that, but there are other symptoms relating to the prostate apart from urinary symptoms. So urinary symptoms, frequency of urination, frequent urination at night. Then you also have urgency. They may not be able to hold on to the urine, so immediately they feel the urge to urinate, they have to run to the bathroom immediately before they actually spill the whole thing on themselves. Then another thing is that a lot of them may have what we call intermittency. The poor stream of the urine that you start experiencing, means that you go to the restroom, you want to pee, there's a normal pressure that the urine comes out with, but that pressure is reduced, and then the flow rate of the urine is also reduced. You now find out that the urine is coming out and then stopping, and you have to wait there a longer time, and then you have to see if you can do some things to make it come out. And then sometimes when you don't expect it to come out, it just comes out, So there's poor stream of urine generally. And then for some people, depending on what prostate condition they have, they may also have blood in the urine. And some people may also experience blood in the sperm, in the ejaculate. It's called hematospermia. So there are 3 major conditions that can affect the prostate. You can have the normal prostate enlargement that comes with age, that is age related. That's what we call the benign prostate enlargement. So that's not cancerous, it's just what comes with aging, normal aging in a man. And then you have prostatitis, which is infection or inflammation of the prostate gland, which can come from sexually transmitted infection, improperly treated infections. And then you can have prostate cancer, which is a different ballgame entirely, because cancer is a disease that starts from a particular source and then starts spreading to surrounding structures, and then can be carried through the blood and lymphatics to distant sites. So that is what actually kills cancer patients, because if the cancer cells now spread from the site of origin to distant sites and start affecting other organs all around. So basically, for people who are over the age of 40 and above, we encourage them to go for a yearly PSA test. It's a simple blood test that helps you know where you stand. So it's called the prostate specific antigen, and is abbreviated as PSA. So when you take that test, normally the reading should be between 0 and 4 nanograms per mil of blood. And if you have your readings abnormal, see your doctor immediately, especially when you have an abnormal reading with these symptoms that I mentioned previously. Then, of course, you have to do your ultrasound scan to check for the size of the prostate, to see whether the prostate is indeed enlarged. And when you go to your hospital, your doctor is going to do a digital rectal examination for you to palpate the prostate and feel for the prostate through the rectum, knowing what the prostate feels like, whether it is soft, whether it is firm, whether it is nodular, whether it is hard. Those things tell the medical professional different things. So when you go for your scan, you're able to know the volume of the prostate, you're able to know how enlarged it is, and then you'll be able to assess the degree of urinary retention you have. Because when you go for your scan, remember, they ask you to drink water, you get pressed, they check the volume of your bladder when it's fully distended, and they ask you to go and pee, and then they compare the volume of the residual urine after you've gone to the bathroom with what was there when it was fully distended. So that can let us know the degree of retention you have. So the more retention you have, then the more the obstruction from the prostate gland.
You said it's prostate has to do with men alone. And let me ask you, what is the cause of prostate? Because we hear this every day. People really don't know what did they cause them. What is it? And then someone told me one of the best ways to mitigate against it is frequent meeting with a woman or something. I don't know if you've heard that, or to tell you what is it again. I heard someone say, but tell us about it.
Well, the truth is, prostate enlargement, that's the non-cancerous type, will come to every man if they live long enough. It's age related. So at some point, a man would start experiencing some degree of prostate enlargement, but the rate at which it enlarges varies, for different people. For some people in their 40s, there's already some degree of enlargement. For some people in their 50s, they've had significant enlargement of the prostate, and the prostate can be so enlarged to the point that it causes complete obstruction to passage of urine, and that is very uncomfortable. You can imagine somebody who feels the urge to pee and urine isn't coming out, so it's quite uncomfortable, and they need to seek medical intervention to relieve the obstruction. So basically, it is age related to start with.
Okay.
For most people, age related. The older you are, the more likely you're going to have that. And for some people that have prostatitis, if they have infection, sexually transmitted infection that was not properly treated, or other urinary tract infection, that they've had over time that was not properly treated, or they self-medicated, because that's another challenge. People have issues, they don't go to tests, they don't go for laboratory investigations, they do not let a medical practitioner assess their condition, and they just go somewhere, get drugs, and start treatment. That may not be the right treatment for them, and they are unaware that whatever they are trying to treat is just there, it's still there, and it's not going away, and it can pose further threats on their health. So prostatitis is usually infection or inflammation of the prostate gland. Then for people that have cancer, of course, that is usually something that comes with advanced age. So the older you are, the more likely you have that. And then you have family history, then you have people that do a lot of alcohol, you have people that smoke, people that eat a lot of red meat, you have people that based on whatever occupation they've been doing, they come in contact with all sorts of chemicals and all that. All these are very relevant history in cancer etiology. So for people to have cancer, you have to make sure that you rule out genetics, the family they come from, the work they do, the diet, whether they are obese or not. All those are important risk factors, whether they smoke, or abuse alcohol. All those are relevant risk factors in the etiology of cancers. So for people that say that frequent sexual intimacy reduces the risk of all that, it's not what is science based
it's not science based.
It's not science.
It's what based now? Human.
Well, it's assumption that people have, and anything that is not science based should be taken with a pinch of salt, because basically science is all about evidence. So you hear when they say evidence based medicine, nobody just starts you on a medication because they just feel it should work. It has worked for Mr. A, it should work for Mr. B. No, it has to be science based. We have to have an explanation, and we have to have evidence to back whatever experimentation we've done. Before you get to a law in science, you come with your hypothesis, you come with experimentation, and then you gather your information together, and then that you have enough evidence to back up a particular claim before you actually come out boldly to say, okay, this is responsible for this, or this can treat that. So for people that have frequent sexual relations and all that, for instance, we still see a lot of polygamous men who come down with prostate issues. So if that was a cure, then that would not happen, of course. And then you also have people who have been unmarried, who also come with prostate issues too, But one thing I know that is common to all of them is age. That the older they are, or the older they get, the risk increases. And family history is a very, very important history in the etiology of prostate related issues. And we once heard that some people were saying if you have sex 20 something times or whatever times.
Did you hear that?
Of course, it was.
Did you listen to that man?
It was an interesting program then, when we heard that. But all those things, set families together and making an income. But you should always remember that it is only when you are in a good state of health that you can be at your optimum performance. Because if you are not healthy, whatever you are running for, whatever you aspire to do would not be successful. So a lot of men forget themselves in the hustle and bustle of life, trying to make ends meet, making sure their families' needs are met and all that. But they should not forget themselves. So we are appealing to men in particular, because women go to the hospital more frequently than men. If they don't go for themselves when they are pregnant, they take their children to the hospital when they are ill. They take their children for immunization. So women still have a closer interface with the hospital than men. So please, men, take it upon yourself that in this new year, you're going to make your health priority, and you're going to take responsibility for your health. Thank you.
Okay, but before I mention maybe the other one, I want to open up the studio lines, and so we can get reactions, okay, or maybe questions or something. All right. 081-717-56338 is the number to call. 081-717-56338, or use the WhatsApp number 081-717-56338. Then to call in 0700-903-903-903. Again, 0700-903-903-903. Like I said, WhatsApp is 081-717-56338. 338. Okay. For women, there's this fibroid thing that is going around like a visitor knocking on I don't know, it's getting too much. They tell you, and because I did not marry early, or maybe I don't have a husband, or I'm supposed to have given birth by now, that's why. So this fibroid thing is even leading ladies to the wrong relationship, because they feel immediately you're done with fibroid operation or treatment or whatever, go and look for a guy, try and give birth and all of that. So a lot is just playing around this fibroid thing. Ladies, very young ladies having fibroid. You're like, what's going on, really?
Well, fibroids are luckily they're non-cancerous tumors or growths of the uterus, the womb, and they're mainly composed of smooth muscle and connective tissue. That's what's basically in it. And based on where they are located in the womb, they are named. Some can be outside the womb, some can be within the cavity of the womb itself. Sorry,
doctor, hold on. Let me talk to this person.
All right.
Yeah. Hello. 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 Good morning to you.
Hello. Hello.
Yes. Good morning.
Is there special people? You people. Yeah. Good morning.
Good morning. What's your
Is
name
there
and where you
special
call?
people? My name is Babo. I'm calling from Oshodi.
Okay.
Can you hear me?
Yes, I can hear you.
Good. Is there special people? You people pick their
Your line is really breaking. Maybe you have to call. Maybe you have to call back. Huh? Yeah, I think you have to call back. You have to call back. Okay. Just hold on, please. Hello. Good morning to you.
Hello, good morning, sir.
Good morning.
Please, you made mention of benign, prostate benign. So I want to know whether it is curable, the enlargement, prostate enlargement. Is it curable?
All right.
Okay, thank you for that question. So benign prostate enlargement simply means enlargement of the prostate that is not cancerous. It is the age-related type. And whenever a man has that, like I said, he should run some important investigations like the PSA, go for a prostate scan, and see the specialist who is called a urologist. So when you go to the hospital and the urologist examines you and he confirms that you have benign prostate enlargement, he would place you on some medications, all right, depending on the degree of obstruction to urine that you have. He may place you on treatments that would allow the prostate to shrink a bit to allow urine to flow. He may also give you some medications that would relax the outlets of the bladder, the sphincter, there, so that you can have ease of flow of urine. So basically, it's a very treatable condition, but the truth is, just like every other condition, you do not wait till things get out of hand. You do not wait till you can't pass out urine at all again, and you don't wait till when you are in that distress, because it's quite a distressing situation where you cannot pass urine, and they have to catheterize you or look for ways to relieve the obstruction. So basically, you go to see your urologist, and there are good and effective treatments that are available. And in some cases, if the enlargement is really, really...
Talk about the one I mentioned just now about ladies. But then several calls now coming in. I don't understand what's going on. Okay, hello, good morning.
Good morning, brother.
Good morning.
Good morning, brother.
Good morning.
Yes, so everything. After I pour my urine with the pipe, with the bag, I pour it. It was the one that used water to wash my hands to clean me that day. That man, God will bless him. Mr. Chiak, I was the one that you helped with his wife that very day. It was, but I thank God after Sister Precious called one or two people from abroad and Nigeria. They raised money for me for operation, almost to ₦1 million. Today now I'm okay, now I'm urinating normal. But now I'm still taking my drugs. Even right now, as I'm listening to you, I just finished taking the prostate and those drugs, so that we'll keep on taking it every week, every month.
All right.
So that it will not occur. But now I want to ask you, please, my question is I want to ask her. In this aspect now sometimes when I find out that if I did not take these drugs and I'm eating normal food, if I'm eating normal food, because they say I should stop eating granite. So I stop eating granite. But I don't know, if I did not take the drugs for 1 month, because it's very expensive, before you know, it's like I will be urinating like a something stone. Things will be coming out and it's very painful. But when I take those drugs, I will not experience anything. What may be the cause? So I want to know. Thank you, sir. God bless you.
All right, thank you so much. And I'm happy that at least you're doing better now. I'm sorry that I had to go through that experience. So basically, even after you've done a procedure relating to the prostate, this is something that you would need to continue management. You would need to have follow-up assessments and follow-up clinics with your urologist. So you don't just do a surgery and disappear. You would need to have constant appointments with the specialist, because the specialist needs to review you at every point in time, and he needs to know how you're doing. the essence of the follow-up is for us to assess you and your progress at every point in time. We're able to know, do we need to change your medications? Do we need to alter taking that drug again? I've started another one. And you're wondering why, who changed you? So please, we must apply wisdom with everything we do. So please, we must apply wisdom with everything we do. When you need to go back to the hospital, go to the hospital. And when you see specialists, please ask questions. When is my next appointment? Because they should see you at intervals for a good follow-up, because that's the only thing that can ensure a good outcome for you.
All right. Thank you. Good morning. Hello, good morning. Oh, okay. Yeah. Okay. 0700 903 903 903. WhatsApp 081 717 56338. Okay. Someone is saying, yeah, I want to touch on this.
Or just like a peanut
Did
size.
you see every woman?
Most of them. Yes, most of them do.
Hmm.
So they have very, very, very little. But it is not all of them that you need to worry about. It is not all of them that even show symptoms, because the symptoms that they normally have are heavy periods, prolonged periods. So you have more than usual periods, lasting up to 7 days, and then you have to change your pads several times a day, and you're having blood clots, and then you're having pelvic pain, and sometimes it can be as big as a 4 kg baby. Some fibroids are really massive, and when it's so massive, it can cause pressure symptoms. It can press on the bladder. Pressure symptoms on the bladder would now make them have frequency of urination.
Okay.
It can undergo some complications called red degeneration, whereby there's a lot of pain, associated with that. And then also it can also obstruct, the passage around the cervix area where the child will pass through. So if a woman is pregnant, the fibroid is likely going to increase during pregnancy in size also, because of hormonal issues. So basically, when a woman is found to have fibroid, when she goes for a pelvic scan, because that's the simplest, investigation you can do, because it will show the location and size of the fibroids and the number of the fibroids, because some people do have multiple fibroids. Some have solitary fibroids that are just one, but most have multiple in different areas. So depending on the symptoms you're experiencing, for instance, a woman who is losing blood torrentially during her periods, and she's becoming anemic, and she's becoming breathless, and she's becoming dizzy and weak and all that, it's time to actually go to see your doctor. And your gynecologist is going to, due to the size of the fibroid. But in itself, as a cause of infertility, there are more higher ranking causes of infertility in women than fibroids. For most women that are infertile, we are more concerned about hormonal imbalances. We are more concerned about not ovulating. We are more concerned about having PCOS. We are more concerned about thyroid problems. We are more concerned about having both tubes blocked from recurrent infections in the past that were not properly treated, like the pelvic inflammatory disease and all that. So we are more concerned about those as major and more prevalent causes of infertility than fibroids. So those are more pressing things to look out for. So a woman who is looking for a child must go for proper evaluation. Her hormonal profile must be regular. And the fact that you're having your cycle doesn't mean you're ovulating. You have to make sure you're not having anovulatory cycles. You must be ovulating in those cycles to increase your chances. And then also, you must also make sure that the tubes are patent, because if the fallopian tubes are not patent, then there's no basis for fertilization. So the fallopian tube being patent, you would find out when you run an investigation called HSG. That helps you to know, whether the tubes are patent. They pass a dye into the womb cavity. It enters into the fallopian.
Sometimes you see people will just be complaining, I'm having this, I'm having that, fibroid, these. You're talking about fibroid. Last year, was it 2 years ago, some time ago, I went to a hospital, it was a friend, a family friend. She went for this fibroid operation. Doctor, if you see what they come out for this lady, they be like twins, two put together.
Yeah.
Very big.
Massive.
Yeah. Massive. What?
Yeah, that happens. And some I've seen where in one woman they brought out almost 15. If you're counting them, different sizes. Different sizes.
15.
Yes, some big, some medium, some small, some big, some medium. And you're wondering, somebody has been carrying this all around. So that happens.
And the way it grows.
Yeah, of course. Yes, of course. So most importantly, a lot of women, when they start having issues with fibroid, because of the society we live in, some people run to look for alternatives they believe is the easier way out, which is, oh, I don't want surgery, or I reject surgery, it's not my portion. So they go for somebody telling them there's something in a bottle that will melt the fibroids. So they'll give you something in a bottle and you drink it maybe 4 times a day, and you expect something as big as a 4 kg baby to melt. And you keep taking that, and you do not bother to find out what the constituents of those things are, and you do not bother to find out what are the potential side effects of those things, because you can't even know what the side effects are when you don't even know what those components are. So please, we are appealing to our people, to the audience. When you have a medical condition, please make sure a doctor, a licensed, registered doctor, examines you, evaluates your condition, sends you for investigation, makes a correct diagnosis, and now outlines their management plan. And it will be in your best interest to comply with whatever advice or recommendations that are given. Because if by yourself you leave the doctor to seek help elsewhere, whoever you're going to seek help from is not a registered person. So the person is not liable if anything goes wrong with you, because you went to them, you bought their products, or you took whatever they recommended to you. So if anything goes out of place, you would only have yourself to blame. So it's important that we see our health as priority. Nobody is going to do it for you. It is you. It is your life. And you take responsibility for it, and make sure that all the decisions you make are made in wisdom and with the right people who can actually give you the help you need.
Someone is asking a question. He's a male though, and he's saying, I have been having gonorrhea treatment over 2 weeks, and I've taken 4 shots of antibiotics injection and still having this burning whatever after urinating. Please, does gonorrhea take that long to heal? What's going on?
Very good question. But I have some questions for you before I can answer you. First and foremost, how did you make your diagnosis? Secondly, where are you getting the antibiotics you're getting? Then thirdly, what kind of antibiotics are you on? Those are all important questions. Because if you are treating something, this goes for every illness. You are treating something, they tell you it is malaria, for instance, and you are treating malaria, and you are using anti-malarial to treat malaria. You're expected to get better, right?
Yeah.
But if you don't get better, then something is wrong. Is either your diagnosis is not correct, or you've not done the right investigations, or something is wrong with your treatment. It has to be one of those. So if you're still having your symptoms, I am not sure you actually do have gonorrhea, unless you tell me that you went to a reputable diagnostic center, did the right investigation, the reports showed that they cultured the organism that causes gonorrhea, and you are using the right medication from the sensitivities on that report. I would not believe you still have these complaints. But for most people that I know, that I hear from, that have similar issues or similar concerns, it's because they wake up one day, they notice they have urethral discharge, or they have pain when they are urinating, or some burning sensation when they are urinating. The next thing is they run somewhere to get medication, and they just tell the person, oh, I woke up and I have this, what do I take? And the person just scans his shelf and brings out something and tells them, take it. And they go to take it. That's his trial and error, if you ask me, because there's no basis for that treatment. Because number one, you're only listening to somebody who is not a medical person, and the person is just giving you some medication to go and try. So if you try it and it works, all well and good. If it doesn't, well, you go back to him for a second trial.
Okay. Now, closely related is the issue of STI. Someone is asking, so let me just find a way to throw it in. He said, is it true that STI cannot be permanently treated with antibiotics except with some traditional medications?
Very good question. Because when you say STI, that's a broad topic. there are many organisms that cause sexually transmitted infections. Not all of them are of bacterial origin. Some are viral. All right. So the ones that are viral, like your herpes, like hepatitis B, hepatitis C, and some other constellation of viral infections. Those ones, for instance, antibiotics would do nothing to them. You can't have herpes and be taking antibiotics. You're not going to get anything because it's a viral infection of viral origin. So you probably need antivirals. And even herpes itself can be latent. It can be hidden for a very long time. In fact, it has been shown that it can stay in the body for a very, very, very long time. It is what causes the cold sore, that's the fever blister that people have on their lips. And then it can also be in the sacral plexus for a very long time. So herpes is in the trigeminal ganglion and in the sacral ganglion, and it can be there for years. So if you are engaging in some kind of sexual behavior, oral sex, and all those kind of things, you had an increased risk of some of those things. So antibiotics are not going to help you for that. But if you have gonorrhea, you have chlamydia, you have syphilis, and all that, well, yes, there are some antibiotics that can help you, and that is even if you present early, because something like syphilis has complications. You have primary syphilis, secondary, and tertiary. In fact, syphilis can actually affect your brain. You can imagine that's called neurosyphilis. Yes, that's the extreme advanced cases. So you can see that time is of the essence, even in your presentation and when intervention starts. So basically, for a lot of people that are thinking STIs cannot be treated, it can be treated, to a very good extent if you present early enough. And mind you, we should also note here that infertility, the rise in infertility cases that we have in both men and women is from STIs, improperly treated STIs over time. So a lot of women that have gonorrhea and chlamydia, they would have PID, pelvic inflammatory disease. They have their tubes blocked, and that is a problem for fertility. For men that have STIs that have been improperly treated, over time, they would also have infertility issues. So STIs are no jokes at all. Once you're diagnosed of an STI, please run to the hospital and make sure that all the treatment regimen that have been given to you, you follow them to the letter. If you need to get injections, you get injections. If you need to follow up with oral medications, you do so. And once you're done, I always advise that you do a post-treatment assessment, So
to find out
exactly whether it's truly eliminated. That helps you to really know that you are out of the woods, with that infection or not, rather than you carrying it and then infecting your partner and all that.
Okay. Okay, let me take some calls now because of those who cannot reach me via text, WhatsApp. Hello, good morning to you. Okay, this person is asking a question. He said, is there any remedy for blocked fallopian tube?
Very good question. When people have blocked fallopian tubes, we usually confirm that through the HSG, like I said. So infertility is definitely inevitable because the sperm cannot reach where the eggs are to cause fertilization. So there are some procedures that your fertility doctor or your gynecologist may try to do to attempt to see if the fallopian tubes can still be opened up, But the probability of you achieving good success with that is quite slim because the fallopian tube is so thin. It's a very small structure. The lumen is so thin. So for you to actually now try to open up something that has been blocked probably for years, the probability is quite slim. But for most people, they would ask you to consider IVF as an option, especially if you have bilateral tubal blockage on both sides. So because you can't be too sure if that's going to help you. And the beautiful thing about HSG is that, we said we pass a dye through your womb cavity, we're expecting a spillage. It is both diagnostic and therapeutic, meaning that it helps us assess the patency and can be a possible way of opening up the tubes too. Some people after HSG, they notice that they have a degree of patency of the tubes. So it's important that anybody that has this condition should have a good gynecologist review them and see if they can help with canalization of the fallopian tube.
Can infection stop someone from impregnating a woman? And can infection also prevent a woman from getting pregnant?
Absolutely correct, both ways. So if you have sexually transmitted infection, like I said, a woman can have pelvic inflammatory disease. So when you say pelvic inflammatory disease, from the name, the pelvic organs, the reproductive organs are inflamed. And then sometimes you have fluid accumulation, pus accumulation, and the place heals by fibrosis, and you have places closing up, tubes closing up, even the uterus too. You may have some adhesions and all that. That can give you a problem with conception.
And the person was asking, he said, which medicine can cure gonorrhea and staph and other infections? This is not where you get that. So that okay, but before we wrap up, I would doctor is going to give out his handles, and probably you can just reach him, right? So just stay there. Good morning, Doc. My name is Da. Please, Doc, I have a question. Blocked fallopian tube, blocked tubes. Can it be reopened again? Any hope for fertility for a lady that the both tubes are blocked?
Yeah, that was just what I just answered. That, well, you have to see a good gynecologist, but you should also be open to the option of IVF, because the fallopian tubes are very, very thin, and for you to want to maintain patency for something that has been blocked over the years by years of improperly treated infection, pelvic inflammatory disease and all that, you may not have a higher chance of achieving patency. But it's very necessary for you to see a good gynecologist who will review you and check what you have as an individual, your individual situation, and then see if they can attempt to recanalize it. If it's not possible, then you may need to do IVF. And for causing infertility in men, mumps infections that cause orchitis, inflammation of the testes, and all that can also affect the quality of sperm production. That is why when a man goes for seminal fluid analysis, we also ask for a culture to know if there's any infection that needs to be treated and eradicated. Because for you to achieve conception, you have to have good sperm counts, good motility. Majority of your sperm should be actively, progressive in motion.
Okay, quickly, because of our time. Okay, while eating, drinking water after food or during food, which?
Well, for me, it depends on the individual. Please, if you are choking, drink water. If you are choking, please drink water. But well, some people will tell you that you do not want to dilute your digestive enzymes, well, that. And then, of course, for people who are obese, we tell them sometimes to drink a lot of water before food so that they have little capacity for food because of portion control. We want to try to control how much they eat. And then for digestion, water is inevitable. You need water for good digestion. For your digestive process to go well, for your body to get proper nutrient absorption, you need to drink water well. But the volume of water you drink while eating varies from person to person. But for me, I just tell you, make sure you eat. After you eat, take water and make sure that your water is at least 2 to 3 liters a day, because we live in the tropics. We sweat a lot, and the amount of via sweating is a lot.
Okay, finally, can fruits and vegetable cure all of these things you mentioned?
They are part of balanced diet. They give you nutrients, they give you vitamins and all that, but they are not curative because you need them even in small amounts. You need vitamins and minerals, and they are trace elements. They are not like your carbohydrates and your proteins. Okay. So they help you with your digestion, they help you with your blood count, they help your overall well-being and all that, but they are not curative. Please, you cannot expect to take fruits and your BP is controlled. You cannot expect to take fruits and your sugar is controlled. You need to seek help, proper intervention for major health challenges. But these are essential parts of a healthy diet. Thank you.
Thank you so much, Dr. Charles Adeogun. Before you go, your social